Okay. Now also, at least one symptom of the two of the following categories: autonomic manifestations, orthostatic intolerance, neural-mediated hypertension, postural orthostatic tachycardia syndrome, delayed postural hypertension, lightheadedness, extreme pallor, nausea, and irritable bowel syndrome, urinary frequency and bladder dysfunction, palpitations with or without cardiac arrhythmias, exertional dyspnea. I'll have to look that one up. I have just about all of those, and which is a big problem. And I had to prove it in the hospital because it give me saline and it'd bring the convulsions and seizures down, which is the first thing to give for seizures anyway. In the hospital, they always give you saline first for anything anyway. And but it was totally confusing for them that saline would bring down the dystonia convulsions, which is still not on my records. I still have being left here, and would bring the seizures down. And I remember nurses commenting, saying, I've never heard of saline bringing seizures down. I've got, I've had a caregiver that they have to take more training now. It's closer to getting to a nurse's degree, which is going to be next for one that I've met, and she says she knows that, and her daughter had seizures from antibiotics, which I've had as well, which they said were psychiatric, and only with my case, did keep everything with my case as psychiatric. It would have been laughable except for so much damage done physically and emotionally. And she said that's the first course, and she was told to keep giving her daughter electrolytes for days when she got her home, when she took her home. And also there's special tests for it. Some of these doctors are using, in Canada anyway, the Hotmaller tests, which is, they can be used, but better ways are that they have tilt tables in the U.S., and there's another way, a real easy way. You just ask someone that has ME and CFS to stand up, and see how long they can stand up in one spot without moving for very long. There's a difference for some reason when you can keep moving, because usually you can't stand up very long in one spot. Now that's not a conclusive way to do it, but some doctors in the U.S. are using that and finding it better than the tilt tables. Okay, now there's also neuroendocrine manifestations, loss of thermostatic stability, subnormal body temperatures, and diarrhea fluctuations, sweating episodes, recurrent feelings of feverishness and cold extremities, intolerance to extreme heats of cold, marked weight change, anorexia, or abnormal appetite, a loss of adaptability, and worsening of symptoms with stress. Yeah, I got all of those. I used to soak the bed. I still do. Not as bad before after menopause, but and especially during a crash, the bed would be soaking wet, and the sheets and the blankets. It still happens, but it would stink of chemicals and toxins. It was a metallic smell. It was a really odd smell. I became a vegetarian for the most part, and also using a lot of naturals to help heal. That's what I was left with when I was cut off and left like this with all the damage done. And I still get the sweats enormously, not as bad as I used to, but the smell has changed. It's much it's a much cleaner smell. It doesn't smell as toxic now, so that's something. There's a good sign, and maybe that's a hint for some other. A lot of people get their fillings out, by the way, which can be dangerous to do if you ingest them. I wanted my dentist to do it before I was brain damaged, and I hated going to the dentist. And they weren't advising them to do it then because the Dental Association was afraid everyone was going to start suing because of putting mercury in your fillings. Okay. Okay. Immune manifestations: tender lymph nodes, recurrent sore throat, recurrent flu-like symptoms, general malaise, and new sensitivity to foods, medications, and/or chemicals. Got all of them. For me, I got about everything on the list of the definitions. Some the first part you have to have all of them, and then there's another list that you have to have so many out of each one, and I have just about all of them. Okay, the illness must be persistent for at least 6 months, and although a preliminary diagnosis may be made earlier, mine was made about, I think it was a little less than 6 months actually, and I was warned it was going to get worse before it was going to get better. Other illnesses will be excluded, which is battery tests that I went through. They did Lyme disease. The amount of testing that I tested I had to take was enormous. Okay. Now, what is some of the areas of research? Neuropathy and brain imaging. There is a disruption in the communication between the brain and other body systems. Abnormal levels in some of the body's chemical messages have been found. There is significantly less blood flow and metabolism in parts of the brain. Small lesions have been found in the brain. Now, not everybody has lesions on their brain that has ME and CFS, but they found that back to 1991. Was it about 1991? I remember I was still working when that came out, and I had to quit work in '94. So it was in the very early '90s that, because I remember taking it to when I was referred to a neurologist by the psychiatrist for neurological problems, and my central nervous system, CNS, being so overamped. I wanted an MRI, and she wanted testing, thinking I had temporal lobe epilepsy was what the neurological problems were. And the neurologist at the Mount Sinai refused to she saw me all right, but she told me to get out of her office. She stood up in a standing pose and told me to get up. Now, this neurologist in 2008, I was told, is saying that chronic fatigue syndrome, myalgic encephalomyelitis, is not a neurological illness. And when we were trying to get me hospitalized yet again at the Western here, and then hopefully at the Mount Sinai after getting everything done all at the same time, as many testing and done, and diagnosis honest ones. We were told to get me out of the country. So it said that in 2008, when it's been passed by law and by the medical community in 2005, so there you go. There's the attitude out there. A lot of them are also scared because a lot of us have been damaged, and there's still a lot of so they don't want to acknowledge that they were ignorant in the first place, and also some have their own opinions that